Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here in this video we can see important and previous year questions for exam preparation. Here we are preparing questions for RRB staff nurse exam, also ESIC, DSSSB, AIIMS NORCET, DME Kerala PSC exam, also insurance medical service and JPHN exam. We can see the questions. First question, major electrolyte imbalance occurs in water intoxication is. Options, option A hypernatremia, option B hyponatremia, option C hypokalemia, option D hyperkalemia. Here the question is, the electrolyte imbalance occurs in water intoxication. So water intoxication or hypoosmolar syndrome is characterized by severe dilutional hyponatremia. Hyponatremia means decreased serum sodium level. So here in water intoxication, the major electrolyte imbalance occurs is sodium. One of the main manifestation is severe dilutional hyponatremia. And the next question, which test is used for bilateral hearing loss of a client? Options, option A Weber's test, option B Allen's test, option C Rinner's test, option D Romberg test. And the correct answer is option A Weber's test. Bilateral hearing loss means the hearing loss that affect both ears. So here the Weber's test is used to identify the bilateral hearing loss. And the second option, Allen test, which is used to assess the arterial blood supply to the hands. And Rinner's test, which is used to identify the conductive hearing loss. Here bilateral hearing loss is by Weber's test, and the test which is used to check the conductive hearing loss is Rinner's test. And Romberg test, which is used for the assessment of balance of the body, that is Romberg test. And the next question, how much amount of blood is transferred from placenta to the baby after the delivery when the cord clamping is delayed till the cessation of cord pulsation? Options, option A 40 to 60 ml, option B 10 to 30 ml, option C 80 to 100 ml, and option D 120 to 150 ml. After the delivery, when the cord clamping is delayed, means about 80 to 100 ml of blood will transfer from placenta to the baby. Okay, so answer is option C 80 to 100 ml. Move on to the next question. A nurse enters a client room and finds that the waste basket is on fire. The nurse immediately assesses the client out of the room. What is the next nursing action? Options, option A call for help, option B extinguish the fire, option C activate the fire alarm, option D confirm the fire by closing the room door. Here the question is, a nurse enters the client room and finds that the waste basket is on fire. Okay, the waste basket in the patient room is on fire. So immediately the nurse helps the patient to come out of the room. And what is the next nursing action? The priority action or the primary action of a fire is to rescue the client who are in immediate danger. Okay, and the next step is to activate the fire alarm. So here, what is the next nursing action? The next nursing action is to activate the fire alarm. Option C is the correct answer. And the next action is, she can confirm the fire by closing the room door. And then next she can call for help. And finally, the fire is to extinguish. Okay, extinguish the fire. The next question, a nurse is monitoring the status of a post-operative client. The nurse would become most concerned with which of the following signs that could indicate an evolving complication? Options, option A increasing restlessness, option B a pulse of 86 beats per minute, option C blood pressure of 110 by 70 mmHg, option D hypoactive bowel sound in all four quadrants. Here, question is, a nurse is caring for a postoperative client. And which among the following signs does the patient need more concern, or which sign may indicate an evolving complication? That is the question. Here, after surgery in the postoperative area, if the patient may experience a restlessness, that may indicate the patient required continuous and close monitoring, because it could indicate a potential complication such as hemorrhage or shock or some related pulmonary embolism or related to respiratory complications. So if the patient may experience increasing restlessness, then we have to continuously monitor the patient. So the answer is option A, increasing restlessness. Second option, a pulse rate is 86 beats, that is normal thing, and blood pressure also normal thing, and hypoactive bowel sound in all four quadrant, that may be a normal thing after surgery. Okay, because the patient may be in NPO status, so that may cause hypoactive bowel sound. Okay, move on to the next question. In which condition the Kramer's rule is used as a clinical assessment method in neonate? Options: option A, neonatal hypoglycemia; option B, neonatal hyperbilirubinemia; option C, neonatal hypothermia; option D, neonatal convulsions. Kramer's rule is one of the quick non-invasive procedure which is used to identify neonatal hyperbilirubinemia or jaundice. Okay, here option B is the correct answer, neonatal hyperbilirubinemia. Move on to the next question. Healthcare-induced infections during any procedure is called. Options: option A, iatrogenic infections; option B, cross infections; option C, super infections; option D, transferred infections. The correct answer is, it is iatrogenic infections. Iatrogenic infections means infections which occurs as a part of treatment, that is during any invasive procedure or during the time of any diagnostic test. That means that it occurs due to the part of treatment, that is known as iatrogenic infection. Second option, cross infection. Cross infection means infection which is transferred from one person to another person, either directly or indirectly, that is known as cross infection. And the next question, which of the following drug is an antidote for opioid poisoning? Options: option A, benzodiazepine; option B, naloxone; option C, protamine sulfate; and option D, none of this. Antidote of opioid poisoning is naloxone. Option B is the correct answer. And C, option C, protamine sulfate, is the antidote of heparin. And flumazenil is the antidote for benzodiazepines. The next question, oxygen and carbon dioxide are exchanged in plasma through the process of. Options: option A, active transport; option B, pin cytosis; option C, diffusion; option D, facilitated diffusion. And the correct answer is, it is by diffusion. Oxygen and carbon dioxide are exchanged in the plasma through the process of diffusion. And the next question, the emotional state in which the individual experiences the loss of loved object is. Options: option A, grief; option B, mourning; option C, agony; option D, none of this. Question is, the emotional state in which the individual experiences the loss of loved one or the loss of loved object, that is known as grief. Option A is the correct answer. Grief means the emotional state in which the individual experiences the loss of loved objects. And the next question, which of the following glands are accessory organs of the digestive system? Options: option A, adrenal gland; option B, gastric glands; option C, salivary glands; and option D, it is pancreas. And the correct answer is option C, it is salivary gland. The glands act as an accessory organs of the digestive system is salivary glands. So far we discussed the important and previous year questions, and we can see the next set of questions in the next video.